Thank you so much for being here. So yes, as mentioned, my name is Kathryn, and I'm the founder and CEO of Anja Health. So it's my younger brother's namesake, as mentioned. His name was Andrew. Today we're going to discuss kind of a little bit about my story, cord blood banking, private banking, public banking, everything kind of under the sun, and then definitely leave room for questions, because I know there's a lot of misconceptions about cord blood banking in general that I'd love to address, or any concerns or anything like that. So this is me and my younger brother, Andrew. He was diagnosed with cerebral palsy from a near drowning accident when I was 3 and he was 1 year old. And so at that point, my parents began looking into treatments for cerebral palsy because his cerebral palsy was pretty low functioning, and they found that cord blood stem cells have been able to be received intravenously in children with cerebral palsy, and they were able to see major motor and social skill improvements, mainly through clinical trials at Duke. And so I was introduced to the space of cord blood research and all the advancements there, and the concept of cord blood banking at a really early age. And then when he passed away in 2021, I wanted to do something that I would have been able to help him, so I founded a private cord blood bank, Anja Health, to make sure that parents know about the options of cord blood banking and know about stories like mine, so that they can kind of have a greater understanding of what cord blood banking is and the importance and impact of it. As mentioned, today we're going to talk about what umbilical cords and placentas do. Of course, you all definitely know about that, but specifically their relevancy to the stem cell space, and then private versus public banking, options for both public and private banking, and also if it's worth it to bank in 2024. So first of all, why we're talking about umbilical cords and placentas today. I'm sure all of you know what they do, but not a lot of people know that especially the placenta is really rich with stem cells. And stem cells are essentially like blink cells that can be used to replace and repair damaged cells at kind of a high level. And so a lot of people know umbilical cords as a resource for stem cells, but placentas specifically have been increasingly used in recent years for treating disease. So I wanted to address that as well. And also, I wanted to include the fact that delayed cord clamping is indeed compatible with both public and private banking options. Public banking has some slightly more strict restrictions around it, but if you do private banking, you can delay cord clamping for up to 2 minutes, which is sort of a common concern I know when thinking about the umbilical cord and what you want to do with it at birth. And sometimes we can even do it for longer. For instance, we've seen doulas that we've worked with, or midwives and OBGYNs that are able to be present at birth, and if the cord is especially juicy and thick and long, then they can actually delay for longer, and they just kind of use their own personal discretion. But it is indeed compatible with delayed cord clamping, so that's something important to know. So now looking at public versus private banking. Public banking, of course, is where you can donate to a registry. The most common registry is the Match Registry, which is available to any patient in need of a transplant, and there is no cost to donate, so those are the pros of public banking. The cons of public banking is that cord blood will only be banked if it is sterile and contains enough stem cells for immediate treatment. So there are a lot of standards around cord blood that's collected and whether or not it will be used. You also cannot do anything with cord tissue or placenta if you are doing public banking, but with private banking you can. And also only qualifying partner hospitals can donate and opt into public banking, so you have to be a parent that's delivering at one of these partner hospitals. And then there's also a laundry list of qualifications that you have to meet as a parent, for instance, no history of cancer in the family and things like that. That tends to disqualify a lot of parents from public banking options. And on the other end of things, you have private banking, where you have automatic access to a 50 to 100% match for family members and the babies themselves, regardless of ethnic background. So I mentioned ethnic background because if you do public banking, it can often be very difficult to find a match, especially if you're a person of color or mixed race and you're looking for one in a public registry. And other pros is that it will definitely be banked regardless of your family history and things like that. But of course, the cons to private banking that people frequently discuss is that it is unfortunately not covered by health insurance unless you are able to demonstrate through a genetic test that your baby will have a certain type of disease. Then it can potentially be covered by insurance. But yeah, that's kind of a great hurdle for many parents. So diving deeper into public banking. So like I said, you have to make sure that your hospital that you deliver at is listed with Be the Match or whatever registry you're donating cord blood to. And hospitals may not be listed due to the number of births in the hospital, diversity in the area, or proximity of the hospital to the bank. So California and New York tend to have a lot of hospitals that are partnered with public banks, but if you deliver in any other state, it may be difficult to try and find a public banking option. And even in California and New York, I know there's like the maternal health deserts that are increasing and things like that. So yeah, a lot of public bank access is thus being restricted as a result. So public banking is not always accessible to everyone. And also, if you want to publicly bank, you have to make sure that you meet certain requirements. So ones that I think really consistently disqualify parents are, for instance, you can only be delivering one baby, you can't have a history of chemotherapy, no fetal abnormalities, no tattoos in the past year, and no history of cancer in the family. But this is a more excessive list of the eligibility requirements for those that are looking into public banking. So yeah, there's just quite a few things that you have to be able to meet if you do want to donate your cord blood. But if you do meet all those qualifications, then you can indeed publicly bank, and at that point you can coordinate donation with your hospital. After birth, your provider will collect cord blood and then label the cord blood unit with a sort of kit that's part of a partnered public cord blood bank, and then it is sent to the bank. And then the cord blood is consequently listed on the Be the Match registry so that searching parents can identify their hope for a cure. So of course, the best part about public banking, in my opinion, is that you have the potential to help someone that really needs it. But like I said, there's quite a few sort of hurdles that you have to overcome in order to bank publicly. So now looking into private banking, this right here is a list of a lot of the major private banks. So this is according to Parents Guide Cord Blood, which is a nonprofit in the cord blood space that looks at a lot of ongoing cord blood research, and they're a really good non-biased resource that involves cord blood banking, both private and public, and just a lot of ongoing research in that area. So I have some brochures in the front from Parents Guide Cord Blood if you wanted to take a look at their resources. But yeah, this is their list of current cord blood banks, and then Anja at the bottom is my company. But yeah, essentially, if you want to private bank, you can reach out to a private cord blood bank, and they vary by lab processes, pricing, and what you can store. So, for instance, at Anja Health, we allow placenta banking versus all the other cord blood banks listed here mainly do cord blood and cord tissue banking. So we do all three: cord blood, cord tissue, and placenta banking. And then we also have pricing options that differ from other companies. And then once you pick the best thing for you, you can receive the kit, bring it to birth, let your provider know that you have it. Your provider will use all the tools inside of the kit to collect whatever it is that you're banking, whether it be cord blood, cord tissue, or the placenta. And then the bank typically compensates for procedure on behalf of the patient. So yeah, if there are some physicians, especially that kind of require that compensation, which is not frequently discussed, but it is definitely a big part of the industry. And then afterwards, you can call for pickup, and a courier will come pick it up from wherever the parents gave birth, and then bring it to a lab where the stem cells can be cryopreserved and used later on in life. So some fast facts on cord blood banking. In 1 in 16 children can potentially use stem cells to better their quality of life. So this is kind of an amalgamation of different probabilities around the probability that a child will develop a certain disease that has been approved by the FDA to treat cord blood, or is it part of a clinical trial looking at using cord blood stem cells. So the chances that someone could potentially benefit from cord blood stem cells is 1 in 16. And as high as 30% of people can't find a match. So especially people of color have difficulty finding a match, as I mentioned. And this is something that's near and dear to me because my younger brother was half Chinese and half white, as am I. And we were unable to find a match, even though I feel like being Chinese and white is kind of a common mix. and it doesn't necessarily make us like a minority by any means, or like to an extent, but it's one of the more common mixes, I think, and we still weren't able to find a match. So I think it just goes to show, the difficulty of finding a match based on ethnicity. And then another quick fact is that 31 states have a law that require OBGYNs to tell parents about stem cell banking. So this law kind of varies. In some states, it's just more like a recommendation. But there are indeed requirements that OBs inform their patients around it. So I also wanted to discuss the placenta because, as I mentioned, Anja Health does placenta banking, and placenta banking is newer to the industry, so I wanted to talk about that. But as you can see here, both the cord tissue, which is the cord itself, and the placenta contain stem cells, specifically mesenchymal stem cells, but they contain different types of mesenchymal stem cells. So you can see here the cord tissue contains certain stem cells, and the placental tissue has an even greater variety of stem cells that could potentially be used for treatment. So delving into this further, why bank the placenta? It is frequently used for neurological degeneration, wounds, bone regeneration, and this is a graphic that kind of shows specifically how the amnion is able to be part of that regeneration and kind of what it entails. And the placenta banking concept actually originated in 1913 when amniotic membrane first began to be used for burn wounds in substitute for skin grafts. So, of course, placenta is such a powerful organ and does so much throughout pregnancy, but even after birth, it can continue to do even more for folks that need it. So today, separate from current use cases of treating eye and topical wounds, hundreds of clinical trials are in progress for furthering many powerful treatment options within placenta stem cells. As mentioned, neurological degeneration, bone regeneration, skin grafts is still, of course, an ongoing use case, things like that. And now adult stem cells have also been used for bone regeneration and repair. Adult stem cells are specifically from an adult, and when you are able to extract it then, there's actually a company called Forever Labs that does this, and they partner frequently with a lot of athletic organizations like the NBA, but they're able to extract adult stem cells from a fully grown adult, so that's another resource for stem cells. It's sort of an alternative if you don't do cord blood banking, but of course it's very invasive to extract those adult stem cells. It's a less invasive process if you're just able to preserve it at birth because, of course, the umbilical cord placenta is already coming out. So this is a little bit more on placental tissue, specifically in relation to chronic leg ulcers, especially in folks with diabetes. So, placenta stem cells in this case in particular were able to help improve the quality of chronic venous leg ulcers and the quality of life in those that have them. And this is also another case study looking at placenta stem cells, specifically with the diabetic foot ulcer, and they were able to discover that 65% closed their wound in just 3 treatments with the addition of CPM with treatment after previously having no success, which directly relates to lower healthcare costs. So it goes to show that having access to placenta stem cells can potentially help even with lowering healthcare costs, in addition to improving quality of life. Okay, so now thinking about if it's worth it to bank in 2024. So I think one of the most controversial aspects of private banking especially is, of course, pricing. So it's definitely something that I think all cord blood banks, including Anja Health, are working on. Things like insurance coverage and being able to get preventative care in general covered by insurance. But overall, I think if parents have the means, private banking is an optimal option. If parents don't have the means, I think there are hurdles, as mentioned, with public banking, but I think anything is better than the umbilical cord and placenta getting thrown away. as you mentioned, I am pretty active on TikTok, and I get a lot of comments around like this conspiracy related to hospitals selling placentas. So I personally, it's not necessarily true, but I think that's an increasing conception that parents have because there's kind of this like conspiracy on social media that's been spreading. So anyways, I find that parents like to have some sort of ownership with what they can do with their placenta, and I think that's resulting in the rise of things like placenta encapsulation and just in general, like what parents can do with their placenta. So I think if parents have the means, a good alternative to encapsulation or worry about it being sold is private banking, but then if not, public banking. So yeah, whether or not someone is doing private or public banking, I think in general, it's important to note that the possibilities with banking stem cells are endless and growing. So this right here is a list of ongoing clinical trials that was published in 2022. And so you can see the specific use cases for cord blood stem cells. This is only for cord blood stem cells, not including cord tissue and placenta stem cells, which of course have more use cases. But a lot of people ask, even providers, like what can these stem cells be used for and where does research stand today? So this is where it stands today. About 58% of all current clinical trials in the US are going towards oncology. So specifically leukemias, lymphomas, and cancers of the brain, breast, bladder, cervix, colon, esophagus, ovaries, pancreas, and others. And then the second most common use case within clinical trials is cardiovascular disorders, so including congestive heart failure, critical limb ischemia, heart disease, and others. And then the third biggest category for clinical trials with cord blood stem cells is musculoskeletal disorders, so spinal muscular atrophy, osteoarthritis, muscular dystrophies, cartilage defects, bone fractures, and others. You can see the list continues even into things like ear diseases and geriatric diseases, lymphatic diseases, general surgery. So yeah, there's really a lot of options for where the research could continue to grow into. And I always explain the stem cell space as sort of like investing in a stock. Like today, there may be only 85 diseases approved by the FDA to use cord blood stem cells, but who knows where it could stand in a decade with this many clinical trials going on, over 1,000, in so many different areas of research. And so another common question that I get is what happens if you don't privately bank cord blood, cord tissue, or placenta stem cells. So I frequently refer to this study, which was published by the New England Journal of Medicine. So this is basically overall survival probability and months following the treatment. So the proportion surviving is on the y-axis, and then months after receiving the treatment is on the x-axis. And the orange line is those that are unrelated to the donor, but the blue line is those that are related to the donor. So I think if folks don't bank cord blood or don't have or seek out a donor, if they're unrelated to the donor, their chances, the proportion of survival is on average lower than if they are indeed related to the donor. And so for that reason, I think private banking is an optimal choice if parents have the means to do it, because your proportion of survival is much higher if you are related to the donor. And then, of course, as an adult, you can potentially still get a related donor through adult stem cells and things like that. But of course, it's very invasive. So I think it's just a good means of sort of prevention in the future. If you're able to store a related donor and have a related donor banking your baby. Finding a donor can also be expensive, so this is the average cost of a stem cell treatment in 2020. So you can see it goes up to $100,000 and can indeed be very exorbitant and more expensive than just privately banking cord blood. And this is something that I touched upon previously, but this is the exact percentage chance of a public donor match being found based on your ethnicity. And so this is from Beat the Match, which is the public banking registry. So this is something that they frequently advertise, especially in communities of color, because they tend to solicit donors in the past in high-income areas. And so as a result, a lot of donors tend to be skewed white because they're being solicited in high-income areas. But then this, of course, results in a disproportionate number of ethnic groups that are being represented on the public registry. And then if you're mixed race, as I am, then it could potentially be even lower than 29%. So this is something that I touched on a little bit ago, but stem cells, if you are a related donor, can be a really strong match. So most public banking donors will only be a partial match, being like 50% or even less. But if you store your own baby stem cells and the baby uses it, then it's 100% match for them, and a 75% match for siblings, a 50% match for parents, and a 25% match for grandparents. So this is another reason why I think private banking is an optimal option, potentially, if you have the means to do so. So I wanted to delve into some case studies that I frequently touch upon. So a lot of folks think that placenta stem cells can kind of only be used in isolation, but it can actually be combined with cord blood stem cells for cord blood stem cell use cases, and this is one of those examples. So this is a young boy named Quentin based out of New Umbilical. In 2007, he received a stem cell transplant for acute lymphoblastic leukemia that he had, and it was actually his little sister's umbilical cord blood and placenta stem cells that were used as a part of that treatment. And now he's in 14 plus years remission. This is another one that was published in 2022, so very recent, and it was a pretty splashy kind of publication. The Wall Street Journal and New York Times discussed it in addition to other scientific publications, but it was announced that a third woman was cured of HIV after a cord blood stem cell transplant, and this was from a related donor, and she has shown no detectable signs of the virus since stopping antiretroviral treatment in October 2020. And this is another one. In 2017, a 57-year-old man had a stroke resulting in right side paralysis and severe speech apraxia. And after receiving cord blood stem cell infusions, this was from an unrelated donor, he remained seizure-free for a long period, experiencing pain reduction around 4 weeks post-treatment and had occasional pain-free days. So this, for instance, is an example. This was a treatment done in Europe, so it was not a part of a clinical trial. And so I always tell parents about these kind of case studies because it is kind of like a one-off potential use case. Like, it's not necessarily clinically proven to help with these kind of use cases, but you just never know. Like, I always tell parents, if you get any kind of diagnosis in the family, you can potentially look into using cord blood stem cells for it. And even if it's not currently part of a clinical trial, it is at least a potential option that you can discuss with your physician that you're seeing in order to potentially explore stem cells as an option, because it could potentially help even if it's not a part of an ongoing clinical trial like in this case, but also something to be wary of because of that. So this is the case study that was really relevant to my family. So this is Dr. Joanne Kurtzberg, who is the main physician overseeing the Duke trial related to cerebral palsy and cord blood stem cells. But as I mentioned, an infusion of a child's own umbilical cord blood can improve brain connectivity and motor function in children with spastic cerebral palsy. And participants who received a larger dose infusion demonstrated significant improvements in motor function 1 year later. And I emphasize the larger dose infusion because that is an example of when you can potentially use cord blood, cord tissue, and placenta stem cells to create a larger dose. So for that reason, I think doing all three tends to be the most popular option because it kind of opens up further optionality. So this is another case study, last one, but it was published with Parents Guide Cord Blood, which is the nonprofit that I mentioned, who's an unbiased resource in the space. But this is the story of a 2.5-year-old boy in Germany who was initially healthy, experienced cardiac arrest after a seizure, and then it led to prolonged oxygen deprivation and a persistent vegetative state. And he actually had his own cord blood banked in Germany, and he showed remarkable progress over the next 3 years, specifically related to motor skills, cognition, and speech. So just a quick plug on us before I conclude, but we do have a podcast, and I, of course, have a following on social media where I talk a lot about my story, cord blood banking in general, all things pregnancy, and we have this podcast where we have providers on. So in the case that you do want to sort of broaden your social media reach, happy to chat about that, and also have you on our podcast. We record in New York City, but can also come to other places. And I have some information on Anja Health, my company, and then also from that non-biased resource, Parents Guide Cord Blood at the front. So I can pass those out at the end of this. Yeah, this is all of my information. So if you would like to connect, happy to do so, and we will follow back on social media. And you can feel free to have any patients reach out to us as well if you have anyone interested or with questions, or if you have questions too, we're happy to answer any type of questions. So yeah, like I said, we have these handouts, some more on mental health specifically, more on parents' guide to cord blood, and then I also have a sign-up sheet in case you are interested in staying in touch or doing social media collaborations or anything of the sort. Okay, thank you.
Yeah. So I don't know what's related, but do you do any DNA banking?
No, we don't. We do have a partnership with Million to One. One of their executives is one of our medical advisors. He was a practicing OBGYN at Cedars in LA. And yeah, so we do have a partnership where we can refer parents to them and they refer the patients to us. But we don't do it ourselves. Yeah.
I mean, you're young, you're going to be around for a long time. You have some succession. How do you?
Yeah, definitely. That's a common question that we get. Yeah, so I think in the cryopreservation space in general, it's such a common part of the industry. So it's very customary to be able to shift the client relationship management to a trusted partner. In fact, so common that we're only 3 years old as a company, but we've taken on 2 other smaller companies because one of them, their founders unfortunately passed away, and the other one, we just didn't want to be in the space anymore. So yeah, in those cases, their actual stem cells are made in the same place, so we just started managing their client relationships and would be able to answer any parent requests or anything like that. So if anything were to happen to us, then we would do the same. Our stem cells would remain stored in the same place, which is at a contracted partner lab in New Jersey, and then we would shift the client relationships to another company.
So that storage lab, like CLIA-approved lab, what's the criteria?
Yeah, they've actually been around for about 40 years in the blood processing space specifically. They also do public banking. They have an arm of public banking, but then they have an arm for private banks to contract with as well. So we're their current private cord blood partner. And yeah, they're aligned with FDA and AABB. In fact, our lab director is currently an AABB accreditor part-time. So yeah, they run a very tight ship.
I'm a primary psychiatrist. So I was just wondering, so it sounds like the public maintenance is some kind of training, but why would you have no control over where that goes and it's not an entirely publicly available thing? And then the private one is almost like the opposite of that. Is there any, can you do any kind of banking where, say I could say, I want my cord blood to be available not only to me and not only to my family, but to anyone who needs it? Is there any kind of in between?
We don't necessarily offer that, but we could if a parent requested it, especially because our lab has the public banking arm. But when parents sign on with us, a frequent concern that we get is how do I know it'll be mine? So yeah, it's definitely going to be their property, and it's up to them what they want to do with it, and it would be illegal for us to do anything with it without their permission. So yeah, if they choose to opt into research or donation, they can. Occasionally we get parents that will send in their cord blood, cord tissue, and placenta, but they only want to do, for instance, cord blood and cord tissue. Then we have an option in those cases for them to opt for whatever they don't want, but is already at our lab, to be given to either research or donation through our lab's public banking arm. So yeah, in those cases, they can opt for that, or they can opt to, do whatever they want with it. If it's their property and they have a friend of a friend or see something on social media where someone needs a donation, then they can choose to do that, but it's totally up to the parent.
What's the cost to buy parent? 10 years why we would pay for it.
So it kind of varies depending on what cord blood bank you choose. If you do public banking, it's of course free, but yeah, like you mentioned, it's then into the public and not ever necessarily going to be accessed by you again. Versus private banking, you can definitely guarantee access. And so yeah, if you go with a private bank, it depends. With us, it's $199 for the kit, and then $49, $79, or $99 a month, starting 1 month after birth, depending on if they choose 1, 2, or 3 of the cord blood, cord tissue, or also the placenta. So especially our monthly options are really popular because we've been able to resonate with the lower income population. But we also have plans where they can choose to pay it all up front if they want to just like pay once and never think about it again. Versus other cord blood banks generally require a pretty hefty payment up front. So accessibility was a big part of our mission, and we're also venture backed, so we're able to do that. And so we don't require like the thousands up front. It's just the $199 up front and then $49 to $99 a month. Versus the average cord blood bank, I think it's around $900 up front, and then $400 a year for life. But ours, we have like a limit to the monthly payments. So they end after 8 years, and then you can, depending on what you choose to store and how you want to do your plans, it can either cover 20 years of storage and then you can renew, or it can cover up to a lifetime of storage. So those plans go into $129 a month. Yeah.
I just have a quick question. So, if somebody uses a private cord blood bank and they store like the cord blood in there, and then it comes time that they actually need it, is there, or do most private cord blood banks then charge for you like taking it out, or is it just like, okay, you can take it and kind of like go to the bank and draw money?
Yeah, we don't charge for parents to take it out. We've actually had a couple parents do that already, but they just need a physician that will be able to receive it and then administer the treatment. So that's kind of on the parent to figure out. And we work with our medical director to ensure that it's going somewhere like in an ethical way. And so we coordinate with their physician and our medical director. But yeah, we don't charge unless it's shipping to outside of the US, in which case things get a little more complicated. So in that case, we do have a slight fee.
Let's say the physician receives the cord blood and not all of that is used. Can they ship it back?
Yeah, generally, like for the ones that we've had, I think the physician can anticipate how much they want to use, and then we'll use all of it. So we store cord blood into 5 compartments so that it can be split up. And I believe they were treating a 4-year-old boy, and they used 2 of the compartments for a first set of treatments, and then a month later they did the remaining 3. So yeah, it just depends on the physician's discretion.
So what happens if a family, begins the process, it's year 2, they can't shoulder the cost, and they can't do this anymore? What happens to that?
Yeah. So with us, we try to be pretty flexible. So we allow them up to a year where they don't necessarily have to pay, but we follow up every month. And then in the 10th, 11th, and 12th month, we follow up every week. And if we don't hear anything, then it's part of our agreement that it can then become our property, in which case we generally donate it to our lab's public banking arm. But yeah, we get some parents that, for instance, like one of them by surprise becomes unemployed and they just work something out with us. So we try to be as flexible as we can. But yeah, generally we limit it after a year.
Do you take family histories on these donors?
Yeah. Wait, so what do you mean by that? Like they're...
It's like, it's just your own internal sense of probability of the things.
Oh, yeah.
So you have family history data on something.
Yeah. So when they first sign up with us, they have to fill out a medical history form. And it's a lot of very similar questions to if you were donating blood, like have you been in these countries in the past 10 years and have you received a tattoo and things like that. But yeah, part of that is medical history.
Do you ask specifically about genetic disorder?
We ask about it, but pretty vaguely. Like we don't have an extensive list, but we do ask, like, did you do genetic testing? Did you find anything? Like, do you have a history of disease? pregnancies, and some parents disclose it in great detail because it's a big part of why they banked. Like we just had one influencer bank with us, and she found out that she was pregnant a week after her husband was diagnosed with leukemia, and at that point they were told that they couldn't have any more kids, and then literally a week later she found out that she was pregnant. And so that was like a huge miracle for them, and she made a big video about it. So that was a really amazing moment. But yeah, in cases like that, like she was really upfront with us that like my husband has leukemia, like I'm concerned about my kids and things like that. So yeah, sometimes we find out through other means, so we do ask as well.
Are you on old social media?
Yeah, everything you can think of, we're on. Facebook, Instagram, LinkedIn, Twitter. Yeah, I'm active everywhere.
I just had a same patients asking me about it.
Oh, cool. Okay, interesting. What do they ask?
We're living like I met my kids 15 years ago, but I don't even know he's out there anymore. You know?
Yeah.
It's just not. I'm just so weird. I did not know.
Okay, awesome. Well, yeah, part of my sign sheet partner, we won't spam or anything, but we can take your mailing address. So if you'd like any promotional materials, we can send both our brochures and Parents Guide to Cord Blood brochures so that you have some resources that you can give out. So we can mail little packages free of charge so that you have some resources available.
How many times can you tap in to that cord blood that's been bent or
Yeah, so I think it really depends on the age of the patient and sort of like the size of their body and physician's discretion. But yeah, like I said, we had that one case with us where they were treating a 4-year-old boy, so they just used like about half of the cord blood or 2/5 of it, and then used the remaining 3/5 later on, and then they still have cord tissue and placenta banked with us. So yeah, it just depends on the use case and yeah, age of patient.
Well, considering
Yeah.
long list of things there from your perspective.
Yeah. I think it would be interesting to just see clinical trials moving further along, and also I'm excited to see more placenta-related progress. Because I think placenta banking is such a new concept. Like there's so many providers that I meet that have never heard of it. But especially for cardiovascular use cases, that's been a more recent use case. So following a heart attack or heart failure. Yeah.
Between all the cord blood banks, is the procurement pretty standardized? Because when I had to do it as a physician, the patient's husband was like, no pressure or anything, but I've already paid all this money up front, so I really hope you can get a cord blood sample. I was like, as like a fellow. It's like, oh, okay.
Yeah.
I hope so too. I'm
Yeah.
putting together for it, but it was a little nerve-wracking.
I've never done it before. There's a refund if they don't get enough cells.
We refunded if they don't get enough. I don't know other mixed policies, but and so I think we always recommend that patients store all three with us, because if, for instance, they get too little cord blood and then they still have at least the cord tissue and placenta with us, we don't charge for the cord blood storage. So the procurement is relatively similar. Honestly, the whole industry is very similar. The main things that differ on the front end of things are how it's marketed and priced, which really just depends on how the company is funded and run and things like that. And then on the back end, there are subtle differences in the way that the stem cells are processed. So, for instance, we do manual processing in the lab, where it's processed by hand as opposed to just run through like a robot essentially, which is called automatic processing. And we do manual processing where it's done by hand because they're able to get up to 25% more stem cells by individualizing the approach to the stem cell extraction and processing versus running it through a robot. So, for instance, if the cord is like, especially long or short, then we can personalize that. But in terms of the kit and what the OB interfaces with, it tends to be the same. So it's like a standard cord blood bag, and then for us, the cord tissue and placenta collection is literally as simple as like putting it in a jar, and then it just goes with the kit. So it's pretty foolproof.
You take the whole placenta.
Yeah, we take the whole placenta. So we've had parents ask if they can like cut it in half so they can give the half to like someone that can encapsulate it or something. But we generally just advise that they choose one and they can process the whole placenta with us.
Thank you, it's been very informative.
Yeah, thank you. Thank you so much. Awesome. Like I said, I'd love to get your guys' information, and especially if you want us to mail you resources, or we can send digital resources, you can name your preference. And then I have some brochures up here too if you just want to please send them. Thank you so much.